Hi there.
Hi, I'm Dan.
Hey, Dan.
Okay, I'm self-employed and my sister's self-employed. Now, my sister's health insurance costs $25,000 out of pocket before her insurance kicks in a penny. Okay? Fortunately, I'm retired military and I have the VA and TRICARE. So, the most I'll ever pay for my insurance is $3 grand a year. Okay? Now, my question, for me, having this is a market solution. Why don't we start, the Republicans say, oh, that's socialism, one payer healthcare. Why don't we start framing the argument as this is a market solution? Because in a free market, the market will always decide, the most efficient allocation of resources. And one payer is that.
Thanks for your question. And I like the way that you put this. Right now, especially in smaller communities and counties in Iowa and in Texas, there's very often only one insurance provider competing for yours or your sister's or our business. It's tantamount to a monopoly. What if we really introduced competition and allowed the market to work? What if you could choose to use Medicare instead of that private insurance provider? That's true competition. It would drive down the cost of premiums, of co-pays, the size of deductibles. Our plan, Medicare for America, says that if you're one of the tens of millions of our fellow Americans that has no insurance or health care right now, you're enrolled in Medicare. If you're one of those Americans who has insufficient health care, meaning you're insured but you can't afford the co-pay or the premium, you can choose to enroll in Medicare. But if you're someone who has employer-sponsored insurance and you like it because it works for you or your family, if you're a member of a union that fought for a better health care plan, perhaps in lieu of a pay increase, and you like that plan that you fought for, you're able to keep that as well. If the goal remains universal, guaranteed, high-quality health care, mental health care, primary health care for women, every woman being able to make her own decisions about her own body and having access to the health care that allows her to do that, then I believe that this is the surest, fastest way for us to get there. Thanks for asking the question.